Hi, it's Dr. Merrill, and here in Coates' classroom, we're going to learn about how we hear, or the anatomy of the ear. So the anatomy of the ear is very complex. As you can see in this picture, there are three different portions of the ear: the outer ear, the middle ear, and the inner ear. And we're going to go ahead and take a deeper dive into all three of those systems. So first we have the outer ear. The pinna, the picture to the right, is exactly what we think of as we look at an ear. So there are different parts of the ear, the pinna. We have the helix, which is the outer area, and we have the conchable, which is the big, deep opening right up into the external auditory canal, which goes into the ear canal. To the left, we have the pinna, as well as you can see the ear canal. The ear canal actually is part of the outer ear. The pinna is shaped to collect all sorts of sound. So its main function is to bring sound to the ear and to that opening. And the ear canal itself, that's where we see a lot of wax or cerumen, any sort of debris. That's actually normal. So there are sebaceous and oil glands that are in your ear that produce wax. Some patients have more wax than others, and that is totally normal. I like to tell patients it's kind of like sweat. Some patients can run a marathon and not sweat, and some patients can break down one dance move and have a lot of sweat. So everybody's glands are different, but cerumen or wax is totally normal in the ear. So then we get to the middle ear. So sound travels from the pinna, it's collected at the pinna, goes through the auditory ear canal, and then hits the tympanic membrane, or the eardrum, is what most patients know of it as. So the middle ear consists of the eardrum and then these three tiny bones. They are actually the smallest bones of the body, but they do a lot of work. So sound vibrates the eardrum, which it's supposed to do, and then that actually vibrates the little bones in the ear. The stapes, which is the last bone, then innervates the inner ear, which we call the cochlea, which we'll talk about next. But sound goes from the ear canal, hits the eardrum, and which vibrates those little bones, which then innervate the cochlea. So when you have fluid in the ear or right behind the eardrum, a massive ear infection, a lot of patients cannot hear. And that's because the fluid goes right around where those bones are and encases those bones. So what happens is when you have fluid in there, the sound has to be louder to actually get the sound to vibrate that eardrum and vibrate those bones to then innervate the nerve. So if you have an ear infection, a lot of times you don't hear as well. Luckily, with that, fluid is a temporary thing. It can be cleared with antibiotics or what we call PE tubes. Those are things you discuss with your ear, nose, and throat doctor if you do have chronic ear infections. Then we go to the inner ear, which I mentioned before, is the cochlea, which is the hearing portion of the inner ear. But you also have the balance portion of the inner ear. They're right next to each other. So a lot of times when we ask you if you have balance issues, it's because the balance system, or what we call the vestibular system, is right next to the hearing system in the ear. So here we have the cochlea, which has a lot of functions. So when the sound hits the eardrum, it then vibrates those little bones. And the very last bone is called the stapes. And the stapes is right up next to what we call the oval window. So when the stapes moves, the oval window also moves. And what that does is it actually makes fluid within the cochlea move. So the perilymph and the endolymph that you see here are actually fluids. And so when those move, they excite what we call the cilia, or the hair cells, which actually send information to the hearing nerve that they're hearing sound. So as you can see here, the cochlea is shaped like a snail shell. So at the very basal end, we see high frequency pitches, and then we go up, and at the very apical end, you see the low bassy tones, or the low pitches. So in a very typical age-related hearing loss, the higher pitches are the first to go, just in terms of the basic wear and tear of the cochlea. So I know this is how we hear. So essentially what happens is we have the sound collected by the pinna, goes into the ear canal, vibrates the eardrum, that vibrates those little bones, which then send information to the cochlea, where that fluid is then moved around, innervating those cells in the ear, and that sends information to the nerve that you're hearing and up to the brain. So even though we're talking mostly about hearing, we're also talking about the inner ear in general. So the inner ear, like I had mentioned before, also has your vestibular system or balance system. So this has, there's 5 different organs. You have your semicircular canals, and then you have your utricle and saccule. All of them are also filled with fluid. So when you move your head in different ways, up, down, linear, side to side, all of that will innervate that fluid, sending information to the vestibular portion of the nerve that you're in motion. If you're having hearing or balance problems, call our office today. That's why we like to kind of ask questions about hearing and balance, because everything is in the ear and closely connected. Thanks, and tune in next time.